Hi, it's Sarah from Complete Core Control and Fit Mummy, and this week our Let's Talk subject is pregnancy and pregnancy exercise and the do's and don'ts. And we're going to try and help you make the right decisions so that you can stay fit and active and healthy during your pregnancy. So today is all about what to avoid when you're pregnancy. So when you're pregnant, what sort of things do you need to avoid? The first one I'm going to talk about is overstretching, and this is quite a controversial one because there are lots of pregnancy yoga classes, and that's great. If it's a pregnancy specific yoga class, then that's great because that instructor is going to take care of you and they're going to know what you can and can't do while you're pregnant. But if you've never done yoga before and you're going to a mainstream yoga class when you're pregnant, then you've got to be a little bit careful because the relaxin, the hormone that's released in the body, is going to loosen off all your joints, particularly the pelvis and the symphysis pubis joint. So things like pelvic girdle pain and that pain down on the symphysis pubis joint, if you're then stretching, you're making that looser, you're making that joint more unstable, and it's going to give you more problems. So you kind of want to avoid that. Also, if you've always been really bendy, if you've always been able to do the splits and you're a dancer or a gymnast or whatever, that still doesn't mean that you want to overstretch or you want to stretch to that level when you're pregnant. You've got to be so careful. The symphysis pubis joint right at the bottom of your pelvis actually opens up while you're pregnant, so that when you come to labour it's an easier process, so the gap gets bigger. If you then say, for example, you've always been able to do this stretch, well, I've always been able to do this stretch, so I'm going to carry on doing it, you've got to really think about, you've maybe always done that, but you've never had that kind of gap in your pelvis. You've never had that looseness through your joints. So you might feel fine while you're pregnant, but for recovery, specifically for recovery, you want to be careful during pregnancy so that you're not causing yourself problems and damage that were going to cause you issues once you've had the baby. So that's why we say, if you're really bendy, great, but just take it back a little bit when you're pregnant, because you don't want to have issues on the other side. Does that make sense? Yeah, good. Okay, so I've got my cup of tea here. Can you see me? Because it's ever so sunny. So next thing we're going to talk about is impact. And again, this is another controversial one because people will say, I ran all through my pregnancies. I did high impact classes all through my pregnancies, and I know I did. I taught body jam and body combat right up till about a week before I had both my children. So you can do it, but again, you've got to be aware of that recovery process, that issue postnatally. So if you look at what training you do, just adapt it a little bit. So don't go mad high impact. Don't run for 20k when you're heavily pregnant, because you think about it, that baby is growing inside you, and impact is meaning the baby's moving and it's pushing down on your pelvic floor and it's pushing down on your pelvis and it's pushing down on your lower back. Okay, so there will be lots of women that will watch this and say, but I ran and I was fine, and that's great, but our advice would be err on the side of caution. Maybe if you want to carry on running, run, but don't run as far, or just be aware as you get to those later stages, as the baby gets bigger, when you're in that third trimester, maybe just wind it back a little bit so that, again, recovery is better. Okay, does that make sense? Good. So abdominal work, what's the point? Your abdominals separate when you're pregnant. So your rectus abdominals go right down the middle of your tummy and they separate for baby to grow. If you work those rectus abdominals whilst you're pregnant, then you're strengthening them with a big gap in them. And again, recovery is going to make it tougher during recovery to get them back together. So you're going to get rectus diastasis, that gap anyway. So just let it open naturally, and then in some ways, not the weaker it is, but the less work you've put in that part of your body during pregnancy, the quicker it will come back together. Does that make sense? So you can't lay on your back after 16 weeks because there's issues with baby laying down and cutting off blood supply and blah, blah, blah. So try not to lay on your back for any length of time if you can, especially in a class environment, and especially if that instructor is not pre and postnatal qualified. So when you lay on your back, the only way you want to do it really is just prop yourself up a little bit, but we would say avoid it. So avoid lying on your back post 16, 17 weeks. So do side lying work, hands and knees is great, but nothing on your back because you just don't want to risk it. If the baby does lie on that vein and it does start to cut off the circulation, you will probably, well, you will start to feel a little bit lightheaded, a little bit dizzy. So there will be warnings if that happens, but really try not to lie on your back for too long. Yeah, makes sense. Okay, what's next on my list that I need to tell you about today? Bear with. Ah, yes, heart rate. So you want to be working to about 60% of your maximum heart rate, okay? So you don't want to be going mad, getting your heart rate up really high because it's just not good for you and the baby. Your core temperature will have risen naturally anyway, so you will feel hotter quicker, and that was the first thing I noticed when I fell pregnant. Didn't even know I was pregnant, but I just thought, why am I starting to feel so hot all the time, especially when I'm exercising? So your core temperature will rise, and you want to keep an eye on that heart rate and make sure that you go at 60% of your maximum heart rate. Now, don't go into a class or don't do exercise and then just stop. Like, keep looking at, I've had girls before in my classes keep looking at what, and then as soon as I get to 60% of the heart rate, just stop. Don't do that. Just keep an eye on it. Just keep monitoring it. And if you haven't got a heart rate monitor, don't worry about it. Just make sure that you're not getting out of breath and your heart, you can feel your heart going. You want to keep it, just dial it down a little bit. Just be a bit aware of your heart rate and how you're feeling. So your general sense of feeling during that exercise that you're doing. And then finally, the really important one is that when you are lying, so when you're on your side or in bed, you are going to turn onto your back at some point. It's natural when you're asleep. We move during our sleep, but always when you're coming back up to sitting, roll onto your side. Use your arms to push you back up to sitting so that you're not using those rectus abdominals. So if you're lying down, you roll on your side, use your hands to push you up. Same thing in our sofas. Our sofas are so comfy that we just sort of like collapse into them. So again, when you've collapsed into your sofa at night, then when you're getting out, don't put all that work through your abdominals. Just turn and lean and lift, okay? Turn, lean and lift. So that's going to help you to, again, not use your rectus abdominals with that gap. And that's another important one to remember once you've had baby, okay? So I hope all that makes sense. That's what to avoid. But if you have got any questions, let us know. And remember that we go live on a week, Monday. On this Monday, whatever, that's the 8th. It's the 8th. So 8th of September 2019, Lizzie and I will go live and we'll talk all things pregnancy, exercise. And then the week after, it's all about postnatal. So it's all that recovery stage. So have a great day and I will see you soon. But questions, let us know. Take care. Bye.